Hello, everyone. It is an absolute pleasure to virtually be here, and thank you for having me. I am very excited to be presenting to the Sex Health Workshop. I would like to thank the organizers for the brilliant job they did by putting this conference together, and the participants for engaging with it. My name is Kitty Kioskli, and I work as a postdoctoral research fellow at the University of Brighton, also as a project manager at Gruppo Maggioli, and I have recently incorporated my own startup named Trustilio. Today, I will devote a couple of minutes to provide an overview of the cybersecurity vulnerabilities and challenges in healthcare, while I will dig a bit further in the existing healthcare security standards and recommend some paradigm shifts. I will jump right into it. When we are referring to a healthcare ecosystem, this does not only include the hospitals as infrastructures, but the whole supply chain involved in healthcare. This supply chain includes hospitals, health centers, clinics, healthcare professionals, patients, imaging centers, IOMTs, and manufacturers. This ecosystem has evolved over the years, and technology has become an inseparable part of it. With technology evolving, the amount of data which are stored and transferred is huge. We have seen a dangerous rise in cyber attacks. This means that more vulnerabilities and cyber threats are arising and will potentially compromise the trustworthiness of the healthcare institutions and the safety and care of many individuals. Currently, the COVID-19 pandemic has fully revealed how unprotected and vulnerable the healthcare systems are, posing an urgent threat to global health. Some recent publicly known attacks in the UK alone are WannaCry, which targeted the NHS computers and encrypted data to demand further ransom payments in Bitcoin, and more recently, the attacks in the ARES healthcare system, which was targeted by hackers who seized all their systems and demanded ransom. The consequences of these attacks can be both direct, such as paying the ransom to the attackers, and indirect, such as affecting the organization's reputation. These events are likely to become more sophisticated and frequent, affecting as a result greatly the care of the patients. Cybercrimes in healthcare are low risk and high reward crimes, while the strongest motivations for attackers in healthcare are for financial profit and political gain. Healthcare data are sustainable and valuable compared to other industries, and this is shown by the value of a set of medical credentials which can exceed $1,000. These credentials from medical identities can be further exploited to gain health services and prescription in medication by discovering an individual's identity or insurance details. As previously said, data stolen from a healthcare organization has also political value. For example, the NHS, which is accessed by numerous people, was hacked by attackers who uploaded images of the Syrian civil war as an act of publishing propaganda. Recently, there have been a number of headlines warning that IOMTs can be used as an up and coming cyber war campaign. The hackers, in order to perform an attack, identify and take advantage of a weakness which can be exploited to cross privilege boundaries within a computer system, otherwise called vulnerabilities in the systems. The vulnerabilities of the healthcare sector, which are exploited by attackers, vary and mainly include the increased interconnection of IOMTs, the use of remote connections for their maintenance, the need to monitor patients in the hospital and at follow-up, the use of digital personal equipment such as smartphones and laptops by both patients and healthcare professionals, and the insufficiency of the IT department to provide certified security solutions and maintenance. Individuals with robust cybersecurity skills and knowledge are fond of challenges to identify and expose vulnerabilities in security networks and IOMTs. Exploiting these vulnerabilities are opportunities or triggers for the attackers, and appropriate capabilities and motivations are needed to carry out the behavior, which would be to perform the attack. The success of the attack and the attack's potential depend on the attacker's profile, which includes the opportunities, capabilities, motives, but as well the psychological, social, and societal traits of the attackers. The aim in general is to transit to a complete cyber reliable state, but this is not an easy implementation. The increased use of IoMT devices in healthcare is one of the major vulnerabilities that attackers exploit. IOMTs are used for a number of purposes, such as health education, preventative care, monitoring patients and alerting healthcare professionals, administrating medications, and monitoring the hospital bed availability. Meanwhile, these devices are also connected to data systems, such as health information systems and health organization networks, like insurance companies. Compared to laptops and computers, IOMTs have weaker security systems since not all devices can be updated or patched, do not meet compliance standards, and have weak encryption protocols, resulting in a whole network becoming vulnerable and open to cyber attacks. Mobile devices and their growing use to deliver care in healthcare infrastructures have further boosted the attack surface. However, the weakest security link, as in any organization, is the human element. And that is the case for healthcare organizations as well, where the biggest security threats are due to internal breaches and employee behavior, as we can see in the literature. Hackers are able, with social engineering, to exploit and take advantage of human vulnerabilities to perform system and data breaches. Besides the vulnerabilities which are exploited by the attackers, healthcare is also facing a series of hurdles and complexities and creates barriers in addressing the up-and-coming security vulnerabilities and contribute to the ineffective adopted approach to cybersecurity management. The main challenges identified in the literature are inadequacy of top management commitment and priority in relation to the organization's complexity and size, lack of awareness, incompatible legal systems, absence of formal security training program, and of course, lack of budget. Hacking systems in healthcare has a significant impact on the operations. This can cause delays in the work of healthcare professions whose job is very much time restricted. As we understand, as a consequence, the care of the patients is affected by delays or cancellations of appointments and treatments. But in many cases, as for example, if the hackers target medical equipment, this can be fatal for the patient. It is worth mentioning that the first strategic analysis report of cyber attacks in healthcare, focusing on the impact of these attacks on people and society, was only published in March 2021, which is a big milestone but has not arrived early enough considering the urgency of the matter. Throughout the report, the Cyber Peace Institute aims to show that while healthcare professionals and patients are facing a significant, evolving, and compounding threat, collective action is possible. The report shows the overarching responsibilities of nation states in leading the way to decrease attacks globally and to hold threat actors accountable. Trying to find a way to defend the sector from the various security vulnerabilities and mitigate the security risks. A plethora of security management standards has been developed that apply strictly to the healthcare ecosystem. Some examples are the American National Standard, Declaration of Helsinki, ISO 1400, and many more. In total, there are 12 standards for healthcare currently in application, which you may find in this table. I will briefly go through the problems with the standards in my following slide. However, these 12 standards is not the end of it. There are also many other processes and guidelines which need to be followed and implemented in order to establish cybersecurity. Such guidance documents which need to be followed are the FDA, numerous directives provided by organizations like NIST, and regulations like the GDPR. These standards come with various challenges. To start with, expectations regarding information security, mechanisms, and processes to be followed in each standard are displayed in a confusing and technical way and are not always adopting the same methodology. Meanwhile, there are common elements, overlapping goals, guidelines, and recommendations within them. Furthermore, nationally and globally, cybersecurity experts are not available in healthcare, while the infrastructure is not regulated appropriately, and there are no transparent mechanisms in order to keep track of the accountability in the cyberspace. Considering the overview I just discussed on the vulnerabilities and security challenges in healthcare, in addition to the summary of the existing security standards and their challenges, what we are proposing here is to adopt innovative methodologies which will act as test beds to overcome these challenges. The proposed methodology here is via the Living Labs. The Living Labs are user-centered open innovation ecosystems based on a systematic user co-creation approach, integrating research and innovation processes in real-life communities and settings. However, cybersecurity issues are not considered in a living lab, as indicated by the lack of literature in the topic. This would make them ideal testbeds for the implementation of cybersecurity practices and a novel method to enhance cybersecurity in healthcare. So, existing research shows that the majority of studies on cybersecurity in healthcare focus on technological aspects. This is surprising considering that most cybersecurity attacks are caused by people, and risk mitigation by technological solutions can only be performed to a limited extent. The foundation of a sturdy cybersecurity strategy ought to be human-centric. Here are some useful references which were included in my presentation, and I would like to thank you very much. And I'm happy to connect with any of you in order to discuss this topic further.